Good morning, everybody. It's 5 to 7 in the morning. I'm showered and dressed, apart from my boots, and I'm ready to go. I've been humming and hawing about this for a few days because I haven't done what they said they were going to do. And the last time they treated me disrespectful, any of them, was yesterday. The nurses last night, really good, excellent night staff. Attentive to all the patients' needs, and even to the little thing of getting them a cup of tea, let alone their medication. The person on the day staff yesterday, what was the name? Beginning with an S and ending with an A or with an H, so you can guess a name. Total disrespect. I'm just doing a video now because I've got this right.
Ah, okay. So I leave it then.
Okay, thanks.
Is I supposed to?
Yeah, I'm drinking that. I know, but I'm leaving today anyway.
Ah, okay, it's fine.
Sorry, I got that lady on video, but I'd actually got a mask on. So I'm off, and you could say that I'm playing into a certain person's hands. I don't know what her problem is with me, or was with me. But now I've got a problem with her. And so there'll be an additional video regarding that. As I say, she says no patches were prescribed or anywhere on the system. Well, funnily enough, the nurse last night found them on the system. So they are prescribed, just as I said, prescribed by the pharmacist here. But they're useless. One has just come up in the shower. I'll show you. Now, just for documented proof here, you can see this. 23rd of the 12th, 23. So the 23rd of December 2023. That was put on at midday. I learnt on the system, and she said, so it's midday today, when the 72 hours are up, but by my reckoning, unless I'm going completely balmy, the 72 hours were up yesterday at lunchtime. The 23rd, 24th, 25th, 26th, 3 full days. 3 times 24 is 72. This has just come up in the shower, and the other one is hanging by a thread. I won't upset you by showing my thigh again. So I'll keep that to show them that I didn't take it off, it fell off, because their one's useless. It's buprenorphine, 70, say there, 70 pg an hour. But that goes slowly releasing medication. Mine are bigger patches and better because although it's nice to have smaller ones that do the job efficiently, they don't. And these were well ready to come off yesterday, and actually did come off today. So I'll put that in a bit of paper towel, and they can have that with no problems from me. I don't believe I've been a bad patient. I've been a compliant patient all along. I've gone from the AMU unit, which acute medical, to a ward, and I can tell you now that it was the wrong ward. This is the neurological ward, the only place that they had a spare bed. Oh, understandable, and I was very thankful for this bed and the clean sheets and the pillowcases and everything else. It also helped make the bed on the days when I could. Kept my room as tidy as I could for the cleaners, and took my tray out when I could walk to the trolley outside on 2 or 3 occasions. So I have attempted to help myself. I did ask if somebody could buy me a walker so I could walk up and down the corridor. 3 people said yes, but 3 people didn't come back to me, so there you go. But these things happen, and I understand it's a busy ward. But yesterday was just one thing too many. The day before Christmas Day, had the doctor coming in just as I'd cut into my sprouts, which I choked on subsequently. And no, it wasn't. It was when I cut into my parsnip, I'd already choked on my sprouts. Let's get things straight on. And regurgitated it. So I cut into my parsnip and was trying to and couldn't. So I had to wait till he went before I took a bite out of it. So my Christmas dinner was spoiled. He stood there for a good 10 minutes, talking at me, thinking it was going over my head, talking over my head, talking to my daughter instead of to me, the patient, as though I was just too ditzy or too old or too, I hate to say the word senile because some people are, it's not their fault, but I've got my wits about me, probably sharper than him, and I don't need that disrespect at this age or at any age, and I won't tolerate it. I just won't. So I'd mentioned him to 1 or 2 people who I felt that I could trust here, but I didn't say by name or anything, just that he was a scruff who was ill-shaven or not shaven and came to the ward as though he just rolled out of his haystack. But that's about it. And then yesterday, 4 times, I asked them Oromorph. I think the first time was just before 5 o'clock. I finally got it at just before 7 o'clock. And only through the carer who was allotted to me coming in, and I said, "Where's my morphine?" She was the first one. I asked for it. I asked her a second time, and I asked another nurse once, carer, I should say, in the light blue, and then I asked the nurse herself as she was walking back up from wherever she'd been. Somebody said she was on a break, and then when she went off, she said, "I'll see what's on the system." And the next time I saw her, she was walking past, deliberately, I guess, not looking through the window. The other one, and the carer, shall we call her Tina? It's actually almost her name. And she waved at me as they went past, and I looked in amazement and thought, what are they doing? And I was sat here, and I was in so much pain with my back. I got into bed and lay there curled up until she came in, and I said, "Where's my morphine?" oh, hasn't she given it to you yet? She knew she hadn't given it to me because she didn't come back down from the station after I'd asked her. And as I say, next time she walked off with not Tina, and somebody else said they got on a break. You know, if people are talking, and as I say, people are talking in the corridors, be aware that people can hear you. And when I said to Tina, is she trying to face me because of not giving me my patches and being so awkward with the morphine or a morph? And she said, no, she's coming down to speak to you. Well, she didn't, but she did come down, and they must have been looking at something on the system. And I heard her say, I was lying in bed, I heard her distinctly say, I'm not happy with what she's been prescribed. She doesn't have to be happy. She's a nurse. She just has to administer what's been prescribed. That's what she's there for. Not to go on numerous breaks, not to stand out. I understand, you know, at work you have a laugh and a joke and everything else. When somebody's in pain, you make sure they've got their meds. She didn't. Leaving today, we've got serious illness in the family. I need to be there for them. I need to not be worrying them whether I'm getting my medication, because I do it myself. And I need to get back to Harriet because she's pining, and I can see that she's pining. It was very, very clear to me in the video my granddaughter sent. Harriet, she's pining, I can tell. So I'm going back to Harriet today, and will I put complaints in? I don't know. Maybe, maybe not. Maybe the video is enough, sort of, for me to get it off my chest. But that's the way I've been treated here. And as for the flexi, something colonoscopy, then clearly it's not going to happen. It could have happened this morning, it could have happened yesterday, it could have happened today, it could have happened this morning, and I could have been out this afternoon, because I do it on a day basis for outpatients. Could have had the colonoscopy a week ago, could have had a proper endoscopy by people who are willing and able to take the time to read properly what's going on in my throat. And the second time I was awake during the procedure, and I was quite shocked that it was in and out and done. They saw the Barrett's esophagus. I don't believe they looked for anything else. And as for the first one, well, who knows what happened there. The doctor didn't exactly inspire confidence, let's say, in the way he was, the way he looked, and his manner. He looked like a prime candidate for certain illnesses, let alone be there to diagnose mine. So I'm going to go private for an endoscopy. I'll get the money, I'm going to take some equity out of my house, and I shall go private for the endoscopy. As for the colonoscopy, I'd like it to be arranged. If they're not going to do it from here, I shall ask my doctor, because it's probably an expense I'm not going to be able to manage without taking a lot more equity out. I'm not going to do that. It's our children's inheritance. And I shouldn't have to. We paid into this system, the NHS, which isn't free. Taxpayers pay for it. Alfie paid for it for 65 years he worked. No, he didn't, sorry. He worked for 50 of his 65 years up until retiring date. 50 years of paying into the system. I worked. Our children all work, all pay into the system. So it's not a free system. And it doesn't work for some, those who it should be working for. It just doesn't. I'll speak to you later when I'm back home. Lots of love, everybody. I'm sorry about the downers, but we'll be a happy reunion with Miss Harriet, and we shall be cuddling together on the sofa. So I'll speak to you all later. God bless. Bye-bye.